Hello! Thanks for watching this video. Watching this series of two videos will help you understand what is the OMERACT Shared Decision Making Group and how you can help us achieve our goals. So what is OMERACT? OMERACT stands for Outcome Measures in Rheumatology. Sounds serious, right? Actually, we are a community of patients, health professionals, and yes, some serious researchers too. We work together to improve care for people living with rheumatic conditions. Our main goal is to figure out what clinical studies should measure so that the findings are meaningful to patients, clinicians, and decision makers. We look at many outcomes that should be measured in studies, such as joint inflammation, pain, fatigue, and side effects. Measuring the same outcomes in clinical trials help us determine if interventions are effective and safe. Our group is particularly interested in interventions to facilitate shared decision-making in rheumatology. Before we talk about impacts of these interventions, let's first explain the process of shared decision-making. So shared decision-making happens when both patient and health professionals make a decision together based on the best evidence from research and the patient values and preferences. Let's look at an example using our 6-step process. Mary is a 50-year-old woman with rheumatoid arthritis. She has been taking methotrexate pills for 3 months. She explains to her rheumatologist, Dr. Joint, that the methotrexate has helped, but she still has morning stiffness and joint pain in the morning for about 45 minutes. She has frequently missed work in the last month. Dr. Joint suggests to Mary to use a tool called a patient decision aid. This will help them decide if they need to consider other treatments, to review information on these treatments, and to help her share what matters most to her. In step 1, a decision is identified. Mary and Dr. Joint realize Mary's arthritis is not well controlled and is affecting her daily life. They need to decide which treatment to add in order to reduce stiffness and pain in the mornings. In step 2, the different options, benefits, and risks are explained. With the help of the patient decision aid, Dr. Joint explains to Mary that there are 2 options which have similar benefits to reduce stiffness and joint pain in the morning. They are taken in different ways and have different side effects. Drug A is taken as a pill twice a day and can cause side effects such as stomach upset and require additional blood tests to make sure it does not cause other side effects. Drug B is taken as a self-administered injection once a month and can cause side effects such as rash and, more rarely, serious infections. In step 3, Mary expresses what matters most to her about the options. Drug A represents a burden on her active professional life due to the most common side effect of stomach problems, and she is afraid to forget to take her medication. However, with drug B, she is uncomfortable with giving herself an injection and is concerned about the risk of serious infections. This is a difficult decision. In step 4, Mary and Dr. Joint weigh the options together. Mary expresses that her priority is to control her symptoms, but she really doesn't like injections. She and Dr. Joint conclude that adding drug A seems to be the best option for her right now. In step 5 and 6, they make a decision together, and they consider barriers and facilitators to putting the decision into practice. Mary will start drug A next week. She will use reminders on her phone to take her pills. Dr. Joint will see her back in 3 months to make sure the pills are working. In summary, the shared decision-making process in this consultation resulted in Mary and Dr. Joint choosing together the most appropriate medication for Mary's current situation by weighing the evidence of the options and what matters most to Mary. In the next video, we will learn about the outcomes of shared decision-making interventions. See you there!